Assalamu alaikum wa rahmatullahi wa barakatuh. This is a short presentation about the ophthalmic and ENT medications in pregnancy. And this is done by me, Dr. Nuha Hatim Qasim, specialist obs-gynae, with my friend pharmacist Hamida Al-Ajmi, pharmacist at Masana'a Polyclinic. So what are the safe medications that can be used in a pregnancy for the eye and ear? As you know, these are the medications that's available in a primary health institute done by Hamida. And the categories, whether C or B or D or A, is mentioned here. So pilocarpine eye drops, consider C. Timolol eye drops, consider C. Chloramphenicol eye drops, consider C. Tetracycline eye ointment, consider B. Ofloxacillin eye drop C. Gentamicin, whether for the eye or for the ear, consider T. Fusidic acid eye drops is safe and can be used in pregnancy. Cyclover, consider B. It is for antiviral ointment. Dexamethasone, FDA considered C, however, TGA considered B3. That means it can be used in pregnancy, but there are a little study done on these drops. Fluorometholone eye drops consider C. Antihistamine, it is safe. As we know, antihistamine, whether it is tablet or eye drops, consider B, can be used safely in pregnancy. Artificial tear ear drops, also considered B, safely to be used in pregnancy. Clotrimazole ear drops, also B. Glycerol ear drops, consider B, also can be used in pregnant women. What about sodium chloride? Also B. Xylometazoline nasal drop C. Sodium chromoglycate eye drops B. Dorzolamide eye drops, there is little study as we say, and it's recommended not to be used. Lantoprost eye drops can be used safely as it is category B. Lantoprost with timolol considered as C. Gentamicin eye ointment is preferred not to be used. Primionidine eye drops can be used safely in pregnancy. Acetozolamide considered C and better to be avoided. What again? Dorzolamide eye drops, we say it is C. Primidine tartrate, consider B. Lantoprost eye drop C. Lantoprost and timolol, again, this is repetition, consider C. Sterile ocular lubricant ointment, consider B. Hydroxypropyl methylcellulose, consider C. Again, these are taken from an article. This is the same what we mentioned before. It's just here you will see the polymyxone is B. Dopramycin is considered also B. Erythromycin and azithromycin can be used safely in pregnancy. If you want to prescribe from outside, you have to know some idea about what are the safe, what are not the safe medication in pregnancy. Again, acyclovir and falsiclovir is safe, antifungal is safe, amphotericin is safe, chlorhexidine oral rinse is also safe. So again, anti-allergy, which we mentioned antihistamine, it's safe, but the other consider not safe. Alpha agonist, we say it is considered safe, B group, which is used as ocular antihypertensive. Anti-allergy, only antihistamine is safe, other is not safe. Anti-inflammatory, whether steroid, we say except dexamethasone can be used, but it's little study. However, the other are not safe. Regarding other medication also is not safe to be used in pregnancy. Again, this is in brief. Regarding antibiotic, you can safely prescribe erythromycin for gram-positive coverage, polymyxin also for gram-negative coverage. It is safely to be used. What about antiviral? You can use acyclovir and valsarclovir. What about antifungal? Amphotericin ketoconazole. What about anti-inflammatory? Prednisolone, dexamethasone can be used. What about ocular antihypertensive? We say brimonidine is safe. So as you say, these are the preferred ophthalmic medication during pregnancy. So as you know, the pregnancy can cause major changes in all the system of the body, whether the skin, the GIT, respiratory, cardiovascular, renal. Visual changes can happen also in pregnancy, so either physiological or pathological. So we have to know what are the physiological and what are the pathological. So if there's any pathological, we have suspicious if there is new ocular changes or changes in existing ocular pathology or ocular complication of systemic disease, like the patient has hypertension or diabetic and she has eye problem. We expect that this hypertension or diabetic can affect on her eye, so need further investigation and to be sent to the specialist for eye examination. So what are the physiological changes in the eye in the pregnant women? Intraocular pressure, it will be low intraocular pressure. The lid chloasma due to estrogen hormone. Conjunctiva, sometimes it happens like hemorrhage. It's called hyposphagma, like this one. You see this hemorrhage. Sometimes this is a conjunctival hemorrhage. This is considered sometimes physiological changes. Tear film. Later in the other slide, we'll explain what it's tear film, but sometimes it's considered also one of the physiological changes. What about the cornea? There will be decreased sensation. There will be increased thickness. There will be alteration in refractive power. What about the lens? There's increase in the thickness and refractive changes. What about the optic nerve? Because the pituitary gland enlargement, so there will be also change in the optic nerve. So as we say, there is a chloasma because increased estrogen, increased progesterone, melanocyte stimulating hormone. And this will mostly appear in the second and third trimester and will disappear. What about the tear film? Tear film, it's happened due to increased immune reaction in lacrimal duct cell. So the destruction of acinar cell by prolactin, which is transforming growth factor beta-1 and epidermal growth factor. Also, there will be dry eye, which is more enhanced by dehydration because nausea, vomiting, and the emetic tract. So there will be like what's called tear film eye. What are the pathological changes? If there is hemangioma, if there is carotid cavernous fistula, ptosis, sometimes ptosis, if unilateral consider is normal, and it will be disappear after delivery. But if there is any change in the pupil, the cornea, this must be sent for ophthalmic doctor because it can happen in Horner syndrome and facial nerve palsy. What about conjunctiva? As we say, sometimes there is hemorrhage normal, but if there's vasospasm, happen in preeclampsia. As we say, systemic disease can affect and on the eye in a pregnant woman, like hypertension and diabetic. What about the retina? There is, of course, in the retina, there will be worsening of diabetic retinopathy, vascular changes in preeclampsia, serous retinal detachment sometimes happen, but it's very rare. And sometimes central serous chorioretinopathy and the growth of melanoma, but these are very rare. Optic nerve, sometimes it's happened due to papilledema or ischemic optic neuropathy. This is happened sometimes due to disseminated intravascular coagulation, a thrombi, and effect on the optic nerve. Optic pathway, cortical blindness, sometimes happen in eclampsia. That's why for any patient with hypertension. We'll ask her to review as soon as possible if there's any visual disturbances, because this is can affect on optic pathway also. This is a very nice from the talk article from Royal College of Obstetric and Gynecology. It is also stated that about the ocular manifestation in a pregnancy, there is physiological changes and pathological. So they say this here is mentioned here, what are the condition affecting the tissue surrounding the eye. We say the melasma is normal. Why? Because of estrogen, progesterone hormone, melanocyte hormone. This is disappear after pregnancy. What about the ptosis? We say it is pathological, but sometimes happen. If it's only ptosis, it is sometimes physiological, but if there is any pupil abnormality, better to send to ophthalmic doctor. What are the change in affecting the front of the eye? We say there will be changes in the cornea and the lens, and also tear film, as we mentioned in previous slide. What about the eye pressure? We say there will be decrease intraocular pressure in the pregnancy. What about the condition affecting the back of the eye? Of course, we say this is happen mostly in hypertension and in diabetic, and also idiopathic intracranial hypertension, which occur also due to retention of fluid lead to papilloedema. So any change in pupil is better to send to ophthalmic doctor. There is a very nice notes that's mentioned here in this doc article of Royal College of Obstetrician and Gynecology. They say here there are limited data about the use of many drugs in pregnancy. The benefits must outweigh the risk to the fetus, and the full discussion will be with the pregnant woman. But they say for most and many topical medication, there is little evidence of harm since systemic absorption is low. But systemic medication should be used with particular caution. So regarding the ointment or the drops, most of the topical medication, it is safe. This is the update about the using of the drops and ointment in pregnant. So again, I will emphasize on this point. For many topical medication, there is little evidence of harm since systemic absorption is low, but systemic to be used in caution. Again, I like this point. They say for any pregnant woman should be advised to apply gentle pressure over the lacrimal punctum for 2 minutes after putting an eye drop to minimize the absorption of the topical medication. So simply, if you want to prescribe, let's say chloramphenicol, and say we say chloramphenicol is category C, but you find that the benefit outweighed the risk to the fetus. So I can use anti-prescribed chloramphenicol eye drop, but what I will tell her, I will tell her to put pressure over the lacrimal punctum for 2 minutes after putting in eye drops. So if you are in doubt of using any eye drops, simple or ointment, we can use this words in which they say for many topical medication, there's little evidence of harm since systemic absorption is low. And also, if we are in doubt, just ask the woman to put pressure over the lacrimal punctum for 2 minutes. So these are a presentation about ophthalmic and ear drop in a brief. And regarding the references, I used these references to support this lecture. I hope you take benefit of this lecture, and if you are in doubt, you can ask anytime. Thank you very much for your listening and for your time.